All right. I did want to, I'm not going to repeat my bio, but I did want to start by sharing a little bit about my background and my different takes on design along the journey that I've been on, which may give some context for some of the perspectives that I'll be sharing with you today and where they've come from. So about 16 years ago, I left architecture school with a design degree that I thought would be absolutely useless. And I'm not sure, like at that point, I think it was because of the patriarchal culture I was exposed to in different design studios. I just concluded I would never, ever become a real architect. And at this point, my take on design was that it was just all about ego, and I didn't want to have a part of it. And then I got into business consulting, and I began to see how my design training was actually helping me to see and solve problems differently than some of my colleagues. And at this point, my take on design was that it was all about problem solving. It's helping me really solve problems. I had this crazy itch to work on more public good issues, and I found a way to think place in Canberra in 2012. I then moved to Kenya, and at this point, design became a lot more about being deeply situated in context. Like, I don't think I really understood what ethnography meant until this point. And after that, after moving to London, I met some other wonderfully thoughtful designers who are Europe-based, and we set up the Sonda Collective. And in this space, for me, design has become a lot more about integrative thinking and integrating and collaborating with diverse disciplines and approaches. And during the same time, there's been this whole process of completing a PhD, and this process really got me questioning absolutely everything from my own identity, my own values, the methods that I use, the tools that I use in particular moments. I just wanted to, like reinvent everything. I just didn't believe in myself or my practice in the way that I had been doing it. And I think that's through various readings and sort of situational sort of moments. I think that my take now on design has become about decolonizing or decoloniality, so to speak. So that just gives you a bit of a sense as to my own takes on design and where some of this is coming from. So how do I say? Okay, there we go. So let's kick off then with a quote from the Bengali poet Rabindranath Tagore, who said, "We have for over a century been dragged by the preposterous West, behind its chariot, choked by dust, deafened by noise, humbled by our own helplessness, and overwhelmed by the speed. If we ever turned to ask progress towards what and progress for whom, it was considered oriental to entertain such doubts about the absoluteness of progress." Now, for me, 80 years on from this point, I just feel like we're still a long way away from where we could be in order to truly resist, truly challenge, and even dismantle this exploitative notion of progress that has dominated for way too long. And I guess today, as a community of design practitioners and thinkers, maybe you're wondering, like, well, what does this have to do with design? And I've just been reflecting on the connection between progress and participation. I just find that participatory design practices have formed part of a bigger participatory wave in projects aimed at social change. And in many of these projects, we are being tasked as designers with making huge decisions on behalf of others in the name of progress. And the risk is that our agency, or the agency of those who contract us, is valued and prioritized over the agency and self-determination of the people who matter the most in these settings. And this is entangled ethics. And that's what I really want to reflect on today. So I will share a few stories and some questions that I have been reflecting on. However, I want to share a disclaimer that although I have attempted to confront the ethical dilemmas of my own design practice at the intersection with international development, I keep failing. I continue to fail at reaching the standards of the decolonial designer that I aspire to reach. So I am very much humbled, Jax, for the opportunity to share my thoughts today. And I do hope that there will also be a space to learn from you all afterwards. So that's my disclaimer. All right, so let's dive in. There's a question. What does decolonizing design in practice involve? For me, there are three key areas. One, it's about the words we use or don't use. Two, the spaces we enable or disable. And the value we co-create or destruct. And so each one of these will be an area to dive into together. So the first one, regarding the words, so many potential things to talk about, but I'm going to share a little story from a co-design project with nurses to improve health worker motivation in Ghana. And I was part of the in-country implementation team where we inherited this framing and this intention. And when we started using that problem framing in early conversations with nurses and their supervisors, it didn't quite translate. It quickly became obvious to us that the use of the word motivation with the nurses meant something completely different than what it meant to the project funders and the decision makers. It emerged that in Ghana, and in the settings that we were in Ghana, associations with the word motivation were linked to money and financial incentives, where in fact there was a strict sort of request that this project was specifically exploring non-financial motivational factors. So when we took that back to the funders, they actually did not permit us to change the official framing of the problem. They pointed us to the very comprehensive academic literature referring to nurses' motivation and demotivation and how that influences performance in the health system. This was really difficult for me because it wasn't about, as a designer, it wasn't about throwing away all this academic knowledge. I think for me, it was about the limitation in the space for holding open multiple frames for the problem. It seemed like that space was really limited. And this prioritization of academic knowledge was getting in the way of the design challenge being framed in the ways the nurses perceived their own issues. And obviously that was quite problematic. Now, despite the lack of formal space to do this, a few of us made a pact on the implementation team, and we kept on using different language with the nurses than we did with higher up decision makers and the funders, etc. So, for example, instead of using the word motivation, we talked to nurses about what they found really satisfying, like what gave them energy, as well as what they found frustrating, and that became the framing for the conversations. To be able to get a deeper understanding of those non-financial motivators in their own words. And we were able to reframe the project's problem statements and tracing back, reflecting back, that really did make a difference, and as it inspired the different types of design solutions that we went forward with in the end, together with the nurses. So it was a little bit of a hack, but it worked, despite having to keep much of this a secret from the funder. So I think there's this sort of these choices we have to make in these moments in practice where it's important, I think, that we ask ourselves some questions, right? And so now, because of that experience and many, many others on this, when designing, I try and ask myself, are there words I am using dishonestly or inaccurately to describe the process and its intention? You hear people talking about like empowering people or empowering processes and things. Like, how honest are we when we say that we're co-designing, what does that mean really? Are the words that I'm using to refer to the people and the places involved aligned with how people self-identify? And question 3, how well am I staying true to the words people actually use and the meanings that they actually ascribe to things? So these are some of the questions that I put to you as well today. All right, so let's move on to the second key point today. The spaces we enable or disable. There's another project I was a part of this time in Kenya, and it was to redesign the national health insurance policy. Think Medicare in Australia, but for Kenya. And that was with the Kenyan government and the World Bank. And there was this intention to achieve greater equity in the healthcare access for groups in society who are in more vulnerable situations. However, I'm going to share how there were factors that influenced why, as a design team, we could not easily, reach we couldn't reach those people who were designated by the government as being in more vulnerable situations. So, for example, Kenyans who were, marked as being of particular interest to be spoken to were in situations that were more likely in a rural area. So they were probably in a position where they were not, they were speaking vernacular languages, more likely situated far from a hospital, and less likely able to afford healthcare when needed. So that's the sort of, factors that would define someone as being in a vulnerable situation, alongside many other factors. But this is how the government group that we were working with was really looking at it. So all these structural factors generally exclude people from many services, and they also make it difficult for design teams to locate and identify. We don't have the vernacular language abilities to really work meaningfully and reciprocally with people in this situation. And because of distance and challenging terrain, they are sometimes deprioritized in design activities, especially when we're constrained by time and budget. So early in this project, one key government official asked me if we would include one of the poorer in his words, and more vulnerable counties of Kenya in the design research work. And of course I said, yes, let's, we have to do this. And then upon going through the approval processes for the travel for the team, it was all not possible. So the Australian government travel ratings were at like the category 4, do not travel, and the design firm's insurance policies actually ended up prohibiting us, me and the team, from going there due to security concerns. And somehow I had to go back to the government official whom I had almost promised that we would go and say that we weren't able to go. And he said to me, like I think it was really hard to hear what he said, but he said, if this county is safe enough for our people to go, then it is safe enough for your people to go. And with those words, I was really confronted by my contradictions. As an exogenous designer in this context, I really began to question, who am I to be here? What am I doing here? It was a really challenging moment. So because of that moment and many other moments like it, I think now when designing, I'm trying to ask myself these questions. So what kind of flexibility is there to renegotiate how the project boundaries are defined after starting? And not just the project boundaries, but these, organizational rules that we sometimes have to abide by. Is there space to break the rules, to push those boundaries? I think that it's really, I think we need to be willing to break rules to design well if we really want to do what we're saying we're trying to do. Second question, is the space carved out for ideas limited to low-hanging fruit, which to me are usually just band-aid solutions, or also support solving for deeper, more complex root causes? And the third question is the space set up in a way that is conducive for others to challenge my approach, my decisions, and the power I hold in my position? Like, how do I, like, it's so great that this government official said that to me. How do we make sure that we can nurture relationships and create spaces where we can receive that kind of challenge and questioning? All right. So moving on then to the third point. It's related to this dilemma intertwined with my sense of privilege, and often having to design in contexts where I have quite a limited stake in the outcome, and in the issues. At the same time, I am benefiting from the international development system's structural imbalances. And there's a story I'll share that really, I think, helped me see this. I was seconded to an NGO for some months while in Nairobi in the early days. And I remember being called into a really big meeting because one of the senior managers had an important announcement. And he announced that, well, we grew our revenue by 22% in the last 12 months. Well done, team. Let's celebrate. Oh, by the way, I'm also getting this promotion. Let's have cake. And he listed a whole bunch of numbers around how under his leadership, they had secured X many new projects, X many new partners, new staff, and of course, the revenue. And I don't know, the quantitatively measurable growth was what was being celebrated and framed as what constituted success. And there was this assumption that, of course, what we're doing is good and causing no harm, even though I wasn't sure about that. We had nothing to point to really believe that. He also shared that the new organizational target was to reach 30 million poor people by 2030. And there was no emphasis at all placed on the quality of that reach. What did it mean to reach? And I've reflected on this a lot, also based on sort of their programs and how they were operating and having sort of an insider view on that. I do believe the organization will actually reach that number of 30 million by 2030. And it's likely because they will send SMS messages to 30 million people and consider that a job well done. And for me, I just wonder, like, how has that really changed people's lives in a meaningful way at all? And it just makes me think and question, like, is this about hitting the target? Or is this actually about missing the point? Like, it's not about hitting the target if we are actually missing the point. And so when designing, and I think about the value aspects, I ask, like, are there publishable stories or data sets that are being pursued more than genuine change in this project? If yes, what am I going to do or not do about it? Who is determining what success means and how success will be measured? Who gets to decide that? Who will benefit or profit most from what is being co-created together? And like looking at my own sort of position in this setting, like what am I giving up and what am I gaining from working on this? So they're the types of questions that I'm trying to reflect on a bit more and really help me have a more honest conversation with myself as I design. So to sum up, the three things: we need to question the words we use and how we are shaping the stories we tell. We need to question the rituals and the boundaries we establish in the spaces we have power over. And we need to question the gains and profits being made and how success is being determined. And to conclude, I'll leave you all with two questions to reflect on. How might we recognize when our agency as designers is prioritized over the agency and self-determination of the people we are designing with? And what are some other questions we should be asking ourselves to help us avoid or minimize this from happening? So I look forward to hearing and learning from all of you today. Thank you.